If you're opening a drug and alcohol treatment center, you've probably heard about the Joint Commission or TJC Accreditation. And if you've done any research, you already know it's a big deal when it comes to insurance reimbursements, credibility, and operational excellence. But what does it take to actually get accredited? And why do so many facilities struggle to pass their initial survey? Hi, I'm Adam Gutton, founder and managing partner of Behavioral Health Partners. My team and I have helped license and accredit over 80 treatment centers across the country. And in this video, I'm going to walk you through exactly what you need to know about getting accredited by the Joint Commission without unnecessary delays. The Joint Commission is the gold standard for addiction treatment centers. If you want to work with private insurance, secure higher reimbursements, and build trust with potential clients, accreditation is not optional, it's essential. Most commercial insurance companies require facilities to be accredited by the Joint Commission or CARF before they'll reimburse for services. And if you're not accredited, your options for insurance partnerships will be extremely limited. But here's the truth. Getting accredited is not easy. The process is long, the standards are strict, and if you don't get it right, your facility can fail the initial survey, forcing you to spend months correcting issues and rescheduling inspections. This is why it's so important to get everything in place before you apply, so you can pass on your first attempt and avoid delays. To get accredited by the Joint Commission, your facility must go through several key steps, each of which requires careful preparation and documentation. The first is eligibility and application submission. Before you even apply, you need to make sure your facility meets TJC's eligibility criteria, which includes having a fully licensed facility that meets state requirements, being operational and providing services for at least 30 to 60 days before your survey, and having all policies, procedures, and documentation in place. If you apply before your facility is ready, you'll set yourself up for failure and major delays. Once your application is submitted, you'll be assigned a Joint Commission account executive who will guide you through the accreditation timeline and requirements. Next, you'll need to complete a gap analysis and policy review. The Joint Commission has strict compliance standards that cover every aspect of your facility's operations, including client care and safety protocols, staffing requirements and credentialing, emergency preparedness, medication management, and clinical procedures. One of the biggest challenges for new treatment centers is making sure their policies and procedures align with Joint Commission standards. These policies need to be detailed, compliant, and fully implemented because when your surveyor arrives, they're going to expect proof that your facility is following them in practice. This is where many centers fail their first survey. They have policies on paper, but their staff isn't trained to implement them correctly. At Behavioral Health Partners, we work with rehab centers to develop Joint Commission compliant policies, train their staff, and conduct mock surveys so they're fully prepared before the real inspection. Once your policies and procedures are in place, the next step is survey readiness and mock inspections. The Joint Commission will send a surveyor to your facility for an on-site inspection, where they'll review all documentation and policies, interview staff and clients, observe treatment processes in real time, and evaluate facility safety and compliance. If anything doesn't meet their standards, they will issue deficiencies, which you'll need to correct before you can get accredited. That's why we always recommend conducting a mock survey before your official inspection. Our team helps clients simulate the Joint Commission survey experience so they can identify and correct compliance issues in advance, avoiding costly delays. One of the biggest mistakes treatment centers make is assuming they can figure it out as they go. The Joint Commission standards are extensive, and if you're missing even one critical compliance factor, it can delay your accreditation by months. We've seen facilities struggle because their staff wasn't properly trained on Joint Commission protocols, their documentation and policies didn't align with TJC standards, or they failed their first inspection and had to go through corrective actions. These mistakes not only cost time, but also money. Every month that your accreditation is delayed, you're missing out on insurance reimbursements and potential admissions. That's why preparation is key. At Behavioral Health Partners, we make sure your facility is 100% ready before you ever apply, so you don't have to deal with the frustration of failed surveys or extended timelines. Right now, we're actively helping treatment centers across the country get accredited. And by the time you're watching this, those centers are likely already operational and billing insurance because we do this with efficiency. We know exactly what the Joint Commission looks for, and we help our clients navigate the process with confidence from initial application to final accreditation. We ensure that your policies, staff, and facility operations meet every requirement so you pass your survey on the first attempt and get accredited as quickly as possible. If you want to know exactly what it takes to get your rehab center accredited by the Joint Commission, fill out the contact form on this page or click the link in the description to schedule a free consultation with our team. We'll help you understand the specific requirements, avoid common pitfalls, and create a clear roadmap to passing your accreditation survey with ease. I look forward to helping you get your rehab center accredited and operational. From Behavioral Health Partners, your trusted partner in growth and impact.